Hey guys, welcome to the brand new episode of the flashcard series, that is the medical fact series. So I'll be discussing 4 flashcards with you today which are really important. So the first clinical scenario I want to discuss with you is about the benzodiazepine overdose. What would be the signs and symptoms of benzodiazepine overdose? Firstly, the patient would present to you with altered mental status. Next, he or she may have ataxia or slurred speech. If the signs of the respiratory depression, or vital sign derangements are there, so you have to, suspect co-ingestion with other sedative, hypnotic, CNS depressants like alcohol. Because in case of benzodiazepine overdose alone, you won't find any signs of respiratory depression or vital sign derangements. This is an important point. Next thing is the difference between the splenic sequestration crisis and the aplastic crisis. Both are different things. The splenic sequestration crisis, what happens is that splenic sequestration crisis occurs in the children prior to the autosplenectomy, whereas the aplastic crisis is occurring after the parvovirus B19 infection. Then, in case of the splenic sequestration crisis, the reticulocyte count is increased, whereas the platelets are decreased. Whereas in case of the aplastic crisis, there are flu-like symptoms, the rash is present, and the retic count is decreased, and platelets remain normal. So you should know the difference, the lab values, like retic count and the platelets. What happened to the platelets in case of splenic sequestration crisis and in case of aplastic crisis. Now, what would be the treatment of the splenic sequestration? Basically, we have to correct the hypovolemia. Hypovolemia should be corrected. Isotonic fluid, small volume transfusions, and eventually we have to do the splenectomy. That is the end treatment of this. Now, another point is that patients with atrial fibrillation who are also having a structural heart defect are at an increased risk of the cardioembolic strokes. And these cardioembolic strokes are sudden onset and they are maximal in intensity at the beginning. Next point is about the FVC and negative inspiratory force. Both of them measure the respiratory strength. Now, if the FVC is decreased by more than or equal to 20 milliliter per kg, then it would it would point towards the impending respiratory failure. In such cases, you have to do the endotracheal intubation. You have to remember that in case of GBS, Guillain-Barré syndrome, you have to do the spirometry. So that's all for this series. Stay tuned.